The urinary system is a complex network of organs responsible for filtering waste products from the blood and eliminating them from the body. This vital system plays a crucial role in maintaining the body's internal balance, known as homeostasis. The urinary system's primary function is to filter blood and produce urine, a liquid waste product that carries excess water, salts, and metabolic byproducts out of the body. This process is essential for maintaining the body's delicate balance of fluids, electrolytes, and blood pressure. Understanding the urinary system is paramount for anyone entering the medical field, as it provides a fundamental understanding of how the body eliminates waste and maintains fluid balance. Throughout this essay, we will explore each component of the urinary system in detail, from the kidneys, where filtration occurs, to the urethra, which expels urine from the body. The urinary system plays a critical role in maintaining the body's internal environment. One of its primary functions is to regulate the balance of water and electrolytes. The kidneys, the primary organs of the urinary system, carefully control the levels of sodium, potassium, calcium, and other electrolytes, ensuring they remain within a healthy range. Another crucial function is maintaining the acid-base balance, also known as pH balance. The kidneys regulate the acidity or alkalinity of the blood by excreting excess hydrogen ions or bicarbonate ions as needed. The kidneys act as sophisticated filters, removing waste products from the bloodstream and converting them into urine. By efficiently filtering waste products and regulating fluid and electrolyte balance, the urinary system plays a vital role in maintaining the body's overall health and preventing the buildup of harmful substances. The urinary system comprises several key structures, each with a specific role in the formation, storage, and elimination of urine. These structures include the kidneys, ureters, bladder, and urethra. Working together, these organs ensure the efficient removal of waste products from the body. The kidneys, two bean-shaped organs located on either side of the spine, are the workhorses of the urinary system. They filter blood and produce urine. The ureters are two slender tubes that transport urine from the kidneys to the bladder. The bladder is a muscular sac located in the pelvis that stores urine until it is eliminated from the body. The urethra is a tube that carries urine from the bladder to the outside of the body. The urinary system also shares a close relationship with the reproductive system, particularly in males, where the urethra serves as a passageway for both urine and semen. The kidneys are the primary organs of the urinary system, responsible for filtering waste products from the blood and producing urine. Each kidney contains millions of tiny filtering units called nephrons. Nephrons are responsible for the filtration, reabsorption, and secretion processes that ultimately produce urine. Blood enters the nephron through a network of capillaries called the glomerulus. The glomerulus acts like a sieve, allowing water, electrolytes, and small molecules to pass through while retaining larger molecules like proteins and blood cells. This filtrate then travels through a series of tubules, where essential substances like water, glucose, and electrolytes are reabsorbed back into the bloodstream. Waste products and excess substances not reabsorbed by the tubules become concentrated, forming urine. Section 5. Ureters, bladder, urethra, transporting and storing waste. Once the kidneys have filtered blood and produced urine, the ureters, bladder, and urethra work together to transport, store, and eliminate waste from the body. The ureters are two slender tubes, each about 10 inches long, that connect the kidneys to the bladder. They transport urine from the kidneys to the bladder through peristalsis, a series of wave-like muscle contractions. The bladder, a hollow muscular organ located in the pelvis, acts as a reservoir for storing urine. The bladder's walls are highly elastic, allowing it to expand and contract as needed. When empty, the bladder is about the size and shape of a pear. As it fills with urine, it expands to accommodate the increasing volume. The urethra, a tube connecting the bladder to the outside of the body, is responsible for expelling urine. The process of urination, also known as micturition, is controlled by a complex interplay of muscles and nerves. Section 6. Medical specialties, nephrologists, and urologists. Two main medical specialties focus on the urinary system: nephrology and urology. Nephrologists are internal medicine physicians who specialize in diagnosing and treating diseases of the kidneys. They manage a wide range of conditions, including kidney stones, kidney infections, kidney failure, and high blood pressure that affects the kidneys. Urologists, on the other hand, are surgeons who specialize in the urinary tract and male reproductive system. They diagnose and treat conditions affecting the kidneys, ureters, bladder, urethra, and adrenal glands. Urologists also address issues related to the prostate, testicles, and penis. Both nephrologists and urologists play crucial roles in maintaining the health of the urinary system. Section 7. Pathologies. When the system malfunctions. The urinary system, like any other system in the body, is susceptible to various diseases and disorders. These pathologies can disrupt the system's ability to filter waste, regulate fluids, and maintain electrolyte balance, leading to a range of health problems. Some common pathologies of the urinary system include urinary tract infections, kidney stones, and kidney diseases. UTIs occur when bacteria enter the urinary tract through the urethra and multiply in the bladder. Symptoms can include pain or burning during urination, frequent urination, and cloudy or foul-smelling urine. Kidney stones are hard deposits that form in the kidneys when there is a high concentration of certain substances in the urine, such as calcium, oxalate, and uric acid. Kidney diseases encompass a wide range of conditions that affect the kidney's ability to filter waste and regulate fluids. Section 8. Diagnostic procedures. Unveiling urinary issues. Diagnosing pathologies of the urinary system involves a combination of patient history, physical examination, and diagnostic tests. These tests help healthcare providers evaluate kidney function, identify abnormalities in the urinary tract, and determine the underlying cause of urinary symptoms. One of the most common diagnostic procedures is a urinalysis, which involves examining a sample of urine for various components, including color, clarity, pH, protein, glucose, blood cells, and bacteria. Urinalysis can provide valuable information about kidney function and the presence of infection or other abnormalities. Another essential test is the glomerular filtration rate, which measures how well the kidneys are filtering waste from the blood. Imaging tests, such as ultrasound, kinetic scans, and MRI, can provide detailed images of the kidneys, ureters, bladder, and urethra, helping to identify structural abnormalities, blockages, and tumors. Cystoscopy, a procedure that involves inserting a thin, flexible tube with a camera into the urethra and bladder, allows direct visualization of the bladder lining and urethra, aiding in the diagnosis of bladder cancer, bladder stones, and other conditions. Section 9. Treatment procedures, restoring balance. Treatment for urinary system pathologies depends on the specific diagnosis, severity of the condition, and overall health of the patient. Treatment options range from conservative measures like lifestyle modifications and medications to more invasive procedures like surgery and dialysis. Medications commonly prescribed for urinary system disorders include antibiotics to treat infections, diuretics to increase urine output, antispasmodics to relieve bladder spasms, and pain relievers to manage pain. In some cases, medications may be needed to control blood pressure, manage diabetes, or address other underlying conditions contributing to kidney problems. Lifestyle modifications can also play a significant role in managing urinary system pathologies. Drinking plenty of fluids, maintaining a healthy weight, quitting smoking, and following a balanced diet low in sodium and protein can help prevent dehydration, kidney stones, and other complications. For patients with end-stage renal disease, dialysis or a kidney transplant may be necessary. Section 10. Conclusion. The importance of a functioning urinary system. The urinary system is an often overlooked but essential system that plays a vital role in maintaining the body's internal balance and eliminating waste products. From the kidneys, where blood is filtered and urine is produced, to the urethra, which expels urine from the body, each component of this system works in concert to ensure our well-being. The kidneys are located retroperitoneally, meaning they are situated behind the peritoneum. Each kidney has an outer renal cortex and an inner renal medulla, which contain millions of nephrons responsible for filtering blood. The renal pelvis collects urine before it moves down the ureters, which are longer in males than in females. Only males have a prostate, a gland that surrounds the urethra and plays a role in the reproductive system. Understanding the anatomy and physiology of the urinary system is crucial for healthcare professionals. Recognizing the signs and symptoms of common pathologies, such as urinary tract infections, kidney stones, and kidney diseases, is essential for early diagnosis and effective treatment. Remember, a healthy urinary system is vital for a healthy life.